Today we're doing an ankle evaluation. So first I'd ask for past history or present history, so like sample or QRST, OPQRST. Next, I'm going to check for swelling, deformity, or like discoloration at the ankle or leg. And now I'm going to do some bony palpations. So I'm going to check the shaft of the tibia and the shaft of the fibula for fractures. Then I'm going to check the medial and lateral malleolus, again for fractures. Then I'm going to check the dome/neck of the talus, again for fractures. Okay, now I'm going to do some soft tissue palpations. Going to test the anterior deltoid ligament, the mid deltoid ligament, and posterior deltoid ligament. Now flip over a little for me. Now I'm going to test the anterior tibiofibular ligament, which is in between the shaft of the tibia and shaft of the fibula, right there. And I'm checking that for a sprain. I'd also check the deltoid ligaments for sprains as well. Then I'm going to check the lateral ligaments, the anterior talofibular ligament, the calcaneofibular ligament, and the posterior fibular ligament. Next, I'm going to check the peroneal tendons. Can you evert for me? Evert your foot. Right here, and there's all along up there, and you're checking that for tendonitis or subluxation. Okay, now we're going to do some special tests. We're going to do the squeeze test, checking that for a tibia/fibula fracture. Now I'm going to do the calcaneal bump test, and that's checking again for tibia-fibular fracture. Okay, now we're going to do some stress tests. So can you evert and plantar flex for me? Invert and plantar flex. So that's checking for the anterior talofibular ligament. Okay, now can you go back to 0 and then just invert? And that's checking for the calcaneofibular ligament. Then can you just dorsiflex and invert? And that's checking for the posterior talofibular ligament. Okay, now we're going to do some eversion. So dorsiflex and evert. That's checking for the anterior deltoid ligament. Now can you...
No, opposite. So you meant plantar flex, right?
Oh, sorry. Plantar flex and evert. That's checking for the anterior deltoid ligament. Okay, now just evert. That's checking for the middle deltoid ligament. And now, now evert and plantar flex. And that's dorsiflex. And that's checking for the posterior posterior deltoid ligament. Okay, and now we're going to do the anterior jaw test. Put a hand on the shaft of his foot and push down. And that's checking for the...
What test was that?
The anterior jaw test. And that's checking for the...
That's the posterior.
Oh, sorry. Anterior jaw test. And that's testing for the anterior talofibular ligament and the anterior deltoid ligament. And now we're going to do the posterior jaw test, which I did before on accident, pushing down, and that's checking for the posterior talofibular ligament. Okay, now we're going to do some range of motion. You could do active or passive. I'm going to have my patient do active. So can you please dorsiflex for me? Okay, that should be around 20 degrees. Okay, can you plantar flex for me? That should be around 50 degrees. Okay, can you please invert for me? That should be around 5 degrees. And can you please evert for me? That'll be around 5 degrees as well.
TikTok, thank you.
Okay, now we're going to do some resistant range of motion.
No, keep going.
We're going to do check for plantar flexion. So can you please dorsiflex for me? And now push against me. and that is checking the gastrocnemius and the soleus for the tibial nerve. Okay, now can you please plantar flex for me? And now dorsiflex. Okay, and that's checking for the tibialis anterior, and also like the deep peroneal nerve. Okay, now can you go into eversion for me? And now can you invert? That's checking the tibialis posterior and the tibial nerve. Okay, now can you invert for me? Now evert. That's checking for the peroneal longus and brevis and the superficial peroneal nerve. Okay, now we're going to do some neurological tests, motor. Okay, can you dorsiflex and invert for me? Okay, that's checking L4. Okay, now can you extend your toe for me? That's checking L5. Now can you evert your ankle? That's checking S1. And can you plantar flex your ankle? That's checking S1, S2. Okay. Now we're going to do some sensory. So I'm going to make sure, test to see if you can feel this. L4.
Yep.
L5. S1.
Yep.
Okay. Now my patient's going to flip over and we're going to test the Achilles tendon reflex. Oh, you're on the paper. Okay. I'm going to test the Achilles tendon reflex. Foot should move. Okay, flip over for me. And now we're going to do some blood flow tests. So I'm going to check the dorsal pedal artery pulse. Okay. Now I'm going to do a recapitalization test. Going to squeeze the toe and check for color to come back. And it should come back within 2 seconds. And then I'm going to compare bilaterally.
Good job.